My name is Thomas Wells. I'm a massage therapist in Santa Rosa, California, and I love the problem-solving aspect of it, where it seems like you can just about figure out any problem using PDTR and explain and make sense of just about any finding you get, any neurologic behavior you come across. So it's really good at kind of looking behind the curtain with these neuromuscular dysfunctions and really seeing what's going on. So I've really enjoyed that about it. And of course, it gets really good results as well, as you would expect. I had a guy come in who had a brain surgery a few months ago, and the tumor, I forget where the tumor was in his brain, but there had been some leakage from the tumor onto his primary motor cortex in his brain, and as a result he had lost all muscle function. I mean, not like paralyzed, but all muscle function, strength anyways, and coordination on the left side of his body on the back half. So only the posterior muscles on the left side were weak, and he had to use a cane and the whole bit. So I was checking some different things around the scar where they actually had to remove part of the skull to get in there. In an area kind of near the scar, but right around where they had cut into the bone, I found an area that if I applied pressure to it, he got all his strength back in his body. That the whole left side came back to life. And I found a very simple, for those of you who have taken PDTR, a very simple neo-paleo pattern up in the brain. It was a thalamic inhibition pattern, and it took all of about 5 seconds to fix, but it brought everything back online. And he was able to move much more easily, and what they thought was something that was going to take months to years to just came back in a matter of seconds, and it was really easy. So that was really cool, and that was just a week ago.
My name is Carl Alexander from San Francisco, and I'm a personal trainer and body worker. And PDTR has been kind of a missing link of sorts. It's resolved a lot of little problems and bigger problems for people so they can move better and be out of pain. So examples are, I'll be training someone, they'll be doing exercise and something won't quite feel right, and so with using PDTR I'll make some adjustments or corrections, and right away they feel the results and they can move better. They feel that there's no pain or there's no restriction. Some bigger cases have been, I've had a case where a woman, she could barely bend over, having a lot of pain, and within one treatment she was pain-free and was able to touch her toes. So it's pretty remarkable. And it's, some of the questions are, well, how long does it last? And the results last. So they're very fast and effective, and they last. And with this technique, we know that when we're able to isolate the problem, know what it is, have that tangibleness of resolving it, knowing what it is, and tracking down where the dysfunction lies and how to treat it.
My name is Bob Gazo. I'm a body worker in San Francisco, California. And I just want to say about Dr. Palomar's work. I had one of the things that I've been hearing about in different classes that I take is treatment of scars. And but particularly in this class, treating a scar, I had somebody that I've been working with for about once a week for a couple of years. And he had total hips on both sides. And we had done a lot with him as far as decreasing his shoulder pain and decreasing his neck pain and getting improving range of motion there. But we always had a lot of trouble with hip strength. So after Dr. Palomar's seminar, I went back, and the treatment for the scars, again, these are really large scars that he had maybe with the surgery that was about 10 years ago, the total hips. And probably 10 minutes each hip, treating each hip. He was able to, for the first time, walk without a limp. And I had previously done muscle tests with him in the internal-external rotation at the hip, and he had almost no power whatsoever. He was fully weak or inhibited in those muscles. And just after the treatment, he had a lot of power back in those muscles. And so with all the other techniques that I've done that I had previous to Dr. Palomar's taking Dr. Palomar's class, I got less results in that year and a half than I did in my first time ever applying this new technique for scars, and I got more results in 15 minutes with this technique than I did in the last year and a half, seeing this guy once a week or three times a month thereabouts. It was one of the pretty amazing case of using PDTR.